I don't know people that have one and she's getting back once at work. She comes in on Jason. I don't know. They used to be stable.
And then, how much do you
Hey, I don't Do you work?
Oh, I just kept driving. Yeah, it's just.
You gotta wait.
12 months to say so, yeah.
Yeah.
How long you been at
Oh. Well, we don't know. We'll find that out, but I'm going to go through my stuff.
I think some people, my friends, they're not supportive. Someone somewhere.
Yeah. We still got to die. We still got to eat properly. Because you put it back on your stomach.
No, on either way,
That's exactly right. They're just to keep us.
Oh my.
What do you think?
I'm very cool because it's often real.
I'm not allergic. It's too overweight. It's only if you want to lose 10 to 15 pounds.
I'm not there then.
No.
No, thank you. Oh, really? Yeah, that's it. And you're losing 10 kilos too. Wow.
Very much.
I'm going to psychologist in Vietnam. I don't want to feel.
Yeah.
And I was there, I can come up with something I could use that one. Whatever.
Welcome everybody. I'm actually just going to take a few minutes before we start tonight and welcome our online audience because they're expecting me to start at 6, but we've had quite a few phone calls for people who have let us know that they're running late and stuck in traffic. So do you mind very much if we give them a few more extra minutes to get here before we make a start? Okay, excellent, thank you so much. I will just welcome everyone who's online watching us tonight and please stay with us, we'll start in just a few minutes. Thank you.
Well, I was reading that.
I'll take one thing though. It will go through the health and medical. My doctor, you know, he's like, and I've seen people fail. So that one, my daughter, the 8 over 8.
Yeah, we can have it outside.
Okay, so
It's the size of the mountain.
Interesting.
my neighbour said, you know, what, with me, I probably not couldn't be
Yeah.
so he's on my head.
Yeah, come on.
Disgusting.
But you gotta do it for 2 or 3 weeks before 3.
I know.
Yeah, you lost right away.
Nice.
Yeah.
A lot of people call to tell us that they're stuck in traffic, so we might get started, but just please don't mind people coming in, and I'll probably sit in front because it sits up the front, that type of thing.
Because we've actually still got quite a few people to join us, are you happy to sort of move forward a little bit so that we can create space for those who are joining us? As long as you're comfortable too, but there's still quite a few people on their way. So yeah, they're all very friendly, make yourself comfortable up front.
It doesn't matter.
Instead.
Are you saying on the
Right.
front, you get space and you've got to sit up the front?
Okay, we don't fight. I am going to make a start because we've actually got people also waiting online for us to get going, and I appreciate that you've all made an effort to be here on time. Can't do anything about the traffic, can we? So I'm sure people won't mind joining us as they arrive, and even if they can't, if they're running late, I'm sure they'll get most of the information that we want to share. So firstly, my name's Felicity. I'm the MC for tonight, and I'm the CEO here of Weight Loss Solutions Australia. I'd like to welcome all of you and thank you so much for joining us. It's such a big step to take to make the decision to attend a seminar of this nature, and I think that's the first really big step that you should congratulate yourselves for. Major step to take, and hopefully, the beginning of something new for all of you, and the start of an amazing transformation. So first of all tonight, let me just give you a bit of a rundown of what you're going to hear and learn tonight. So basically we're going to give you a complete overview of all of the procedures that we offer here at Weight Loss Solutions Australia. Answer as many of your questions as possible. This is about you, so please take the time and the opportunity to ask whatever you like. All of our team will stay at the end as well, so to give you an opportunity to address any questions that you might have. So this is your learning opportunity. All right, welcome, come on in, have a seat. All right, so you're going to hear from all of our team tonight. I'll just actually quickly, briefly introduce you to our team. Melanie's our patient relationship officer. We all tend to wear a few hats here. So not only is Melanie here in a work capacity, but tonight she's also going to share a little bit of her own personal story in relation to her own bariatric surgical procedure. And where that's taken her is just amazing. So you'll really get a lot out of hearing that. Taryn is our accredited practicing dietitian. She's going to give you a little bit of an insight into what eating looks like with all of the interventions that we offer here, and give you a bit of a feeling of what it's like to engage with the dietitian, especially over the first 12 months when it's such an important time for you to work with our team. Our psychologist Warren is going to talk to you about his role here and what he does to support you. A lot of the work that they do is together. You'll find that there are some group sessions as well post-operatively, so they'll give you a bit of a feel for what to expect when you're coming through the system. Who have I missed? Michelle is on reception, and there's two Michelles, sorry. Michelle is not only a medical receptionist here, but she's also a chef and is involved in assisting with running some amazing cooking sessions that we offer for patients in their first 12 months. In fact, we just had a cooking class and demonstration tasting about a week ago that was fantastic, run by our dietitian and Michelle as the chef. So those are things that are offered to you that you really should take advantage of. It's a lot of fun and it's designed to help you learn lots of new things along the way. And Michelle Scott is our bariatric nurse, and she also wears a number of hats here. So not only is she very involved in the pathway of working with every bariatric patient through the system, most specifically working with the gastric banding patients, Michelle is absolutely a world of knowledge when it comes to how to manage and look after gastric bands, and she does all of the adjustments for gastric banding patients. So that's just part of what she does. Her clinical nursing role also extends to management of clinical trials. We've been fortunate enough here in this clinic in the past to have run a new clinical trial for a new device. We had about 50 patients here over a duration of 3 years on a trial that Michelle was responsible for managing. So that's part of what she does. Tonight she's actually going to give you a complete overview of all of the procedures and how they work. Right, so that's how tonight looks. Any questions about that at the moment? Okay, all right. So basically as well at the end I'm going to run through the process for all of you so that you understand what actually happens, how does it work when I come here as a patient and what to expect. So I will run through all of that at the end, and I always like to make at least some special offer to people who make the effort to come along to a seminar like this and make it really worth your while. All right, just a couple of things that I want you to start thinking about. Has everybody got a notepad? Yep, notepad, pen. All right. I'd like you to actually just take a moment to write down now, what are the top 3 challenges that you're facing in relation to your excess weight? So start to just think about what are my top 3 challenges, how do they impact my life, and they might be the top 3 things that you'd actually really like to see change, that they might be the pivotal, one little thing that might have driven you here tonight that's made you think, oh, I really need to do something about my weight. So just take a moment to think about those things. And it's different for everybody. It might be, I can't play with my kids, I'm not participating in my children's sport, I feel like I'm just, a bystander, I want to get more involved. It might be something like, I can't tie my own shoelaces up. It's personal and different for everybody. It might be discomfort sitting in an economy aircraft seat. So, whatever the challenge is for you and whatever you're thinking about now that's important that you'd like to see change, just take some time to write down those top 3 challenges. And everyone at home too, please take the time to do that as well. It's worthwhile to start thinking about what are the things that you'd like to see change in your life. Okay, and it's personal. I'm not collecting these up. This is for you. This is for you to think about for yourself and to hang on to for yourselves. I did forget to mention as well tonight, one of the best parts of coming along to a seminar like this is that you do get to hear from some amazing patients who've sat in your seats and started their journey off in the same way. And they're here to share their inspiring stories. And I couldn't be more excited tonight than I am to introduce you to some really lovely and very generous people who've come along to share their own personal stories. So we tend to like to save the best for last. So that will be later on the agenda. In fact, our guest speaker I didn't recognise tonight. So if that gives you any indication as to how far he's come, well, there's 3 guest speakers, but our sleeve guest speaker I really didn't recognise at all. So yeah, just incredible to see such a phenomenal physical transformation and to no longer even recognise a person. That's just got huge wow factor all over it. It's amazing. Okay, so now if you've written those 3 things down, what I'd really like you to think about is what is it that you think you'd really like to achieve with a bariatric surgery procedure, and where do you see yourself 12 months from now? That your vision of a better, new, improved self, what does that look like to you? And just take a moment to write that down and think about that. And that's the journey that we want to take you on and work with you to achieve. Is everyone comfortable in the room? It's not too cold? Everyone okay? Yep. Okay. All right.
Cold, be cold, yeah.
And the reason that I get you to think about that and what you'd like to see yourself and how you visualise what does that journey look like for me, where would I like to be in 12 months from now, is to really get a feel for that is really possible. That incredible transformation that you might not have ever been able to achieve before is something that we want to realise with you and take you on that journey with an amazing team of people that will work from A to Z to get you there. So just have a moment to think about what that looks like. So some of the reasons that we actually offer bariatric surgery, first and foremost, health concerns and the risks and the complications that go hand in hand with being, excuse me, either overweight, excessively overweight, or morbidly obese. The medical risks and complications are vast, and some of them you might just be thinking about and thinking, I don't want that to be me, or you might be starting to feel them now. Can I have my water? It's actually too cold.
Yeah, I just turned it up a little bit.
It's getting to my throat. Oh, sorry. Some of the things that we see change even at 6 weeks post-operatively. With a sleeve gastrectomy, we see people get off their blood pressure medication, type 2 diabetes medication, and the results are incredible. So I think because my throat's got a bit funny, I might hand over to Michelle to start talking about the bariatric procedures.
Hello everyone. All feeling relaxed? Yes, excellent. Well, Felicity just touched on a couple of things that are associated, isn't it, with being overweight or morbidly obese, those things that happen like diabetes, hypertension, other things that infertility, all those sorts of things can be impacted, joints, joint pain. So all those things are associated with, you know, these issues. And so it's important when you look at dealing and managing this that you look at the whole picture. And here at Weight Loss Solutions Australia, that's exactly what we do. We take very much a holistic approach. We look at the whole person and the individual and all that that means. So you're going to hear from me right now the basics of each procedure. But a little later on, Taryn and Warren are going to unpack some of those other areas that are really important in your journey along this this road that you're choosing. So just bear that in mind. If I'm not covering everything, don't panic. You'll hear that information later. For example, there's a dietary regime that goes with each particular procedure, but there's no point me wasting time on that. Taryn's going to cover that, okay? So, but if you do have any questions, please feel free to interject and ask me. Okay, that's what we're all here for. So, as I said, we like to consider the whole person and take a really holistic approach. So let's cover the 3 different therapies that we offer from the surgical perspective. We're going to start off with the Albira. An Albira balloon is this one here behind me. I heard some of you talking about it, so they're a great talking point, these signs behind me. So this is a procedure that is non-surgical. It's considered non-surgical. It's something that's put into the stomach, not in this size, by the way. It's all folded. And there's no saline in there, don't worry. They don't make you open up wide and swallow it. Okay, so you have a gastroscopy. Okay, so you have a light sedation. It's put in under that light sedation, and it's attached to this little tube here through the gastroscope. It's then inflated, obviously with saline. Okay, and it sits inside the stomach. And then that's obviously taken off, and that's what sits there. It's something that stays in for a period of 6 months. And it's ideal for those who are wanting to look at losing 10 to 15 kilos. It's a fantastic one where patients present to, for instance, an orthopedic surgeon and they need joint replacement or something like that, but they need to lose some weight in the short term in order to qualify for the surgery. So it's a really great tool for that. It's, as I said, it sits inside the stomach, obviously fills the space, and makes you feel full on small amounts of food. It's very low risk, very little complication. Really the only complication is that it's not tolerated by something. That's quite a small amount of people, but once again, it is removed after 6 months, and it's removed through a gastroscopy as well. Okay, so the risk is that it's quite small. As I said, it's got a really good place for those that are wanting to lose that 10 to 15 kilos. One of the key things with all of these therapies that I'm going to touch on tonight is that it's all about the follow-up and really plugging into the resources here in the clinic. And we actually offer a 12-month program around that, because 6 months you have the balloon in, you adjust your lifestyle, change different things and learn different ways of doing things, and then we see you for 6 months after you've had it removed as well, just to help you maintain those lifestyle choices. Okay, so it's a really effective tool for those that are wanting to lose that weight. It looks a bit weird, I know, and it's actually fuller than that normally. It's 500 to 700 mils they put in there, depending on what's required when they see that. Okay. Does anyone have any questions on that one at all? Nope. Okay. Moving right along, we're going to talk about the sleeve gastrectomy. Now, does anyone get freaked out by looking at medical equipment? Because I've got a great treat for you tonight, if you like. And I was talking to some of the team, and they were saying, I hope you don't freak anyone out. But my background is theatre nursing, so I'm all into the tools that they use in theatre. We've all heard of keyhole surgery, have we? Yeah? Okay, so keyhole surgery obviously means that you're working through a small port or incision in your skin, and they do everything inside. So you still have the major surgery, but it's all done with a small incision. So this is kind of what they look like when they're putting ports inside. So with a sleeve, what they do is you have 5 incisions over your tummy. A sleeve gastrectomy is where they cut out 2/3 of your stomach. Okay, so it's removed. It is major surgery. It's important to consider that, but it's also a very effective bariatric procedure. So they work through little keyholes. You've got 5 incisions that happen, and different varying sizes, obviously depending on the instruments that go in. Is this freaking anyone out? All right, I hope no one at home's freaked out by this. I'd hate for that to happen. So when we talk about, it's called a sleeve gastrectomy for a reason, okay? And it's called a sleeve gastrectomy, or you might have heard of, they have heard of stapling the stomach. Okay, so obviously when they cut the stomach out, they've got to put the ends together so that it, forms a new stomach and doesn't leak. And the way that they do that is with staples. Now, is this a gun or is this a gun? Hey, it's pretty cool, isn't it? I just thought I'd give you a visual of how it works, okay, and the technology that's involved in these, which makes your recovery from these procedures so much quicker because you're only using small incisions. So this is a little staple gun that they put in. Obviously there's little staples that sit in there. It clamps down on the stomach, and it's really clever because it cuts and staples at the same time. Okay, and it cuts on both sides, so the stomach that's staying in as well as the stomach that actually gets removed. So if anyone wants to play with that later, you're very welcome. I'll show you how it works. Anyway, I hope I haven't freaked you out, but it's a good idea to see that. So the sleeve gastrectomy is obviously permanent. There's it's a higher complication, but it does create some great weight loss, averaging between 2 to 4 kilos a month, and it's quite rapid, particularly in the first 12 months. The great thing about it is, once again, when you're moving through each stage, you have follow-up through the clinic. So we like to see you regularly at the clinic. You see Warren, you see Taryn, you see myself, just to make sure that you're managing with the different lifestyle changes that are required. There are, of course, risks involved with the sleeve, and it's important to mention that to you tonight. The main 2 complications that can happen with a sleeve gastrectomy is bleeding. Obviously, it's major surgery, and we're cutting out part of an organ. So bleeding is a complication, and you may have heard of something called a leak. Okay? So a leak happens, or can potentially happen, obviously along the staple line that we talked about that gun creates. And a leak means it's come apart. So obviously, I can't remember what the percentage is. Can anyone help me out with the risk of a leak?
1 in 5.
Yeah, 1 in 500. So it's fairly low, but it is important that you know that that's a potential complication, and then surgery is required for that to fix that. All right. Recovery, as far as the sleeve is concerned, you're looking at a couple of weeks of recovery. So, if you're going to arrange your time off work, you'd want to take off at least a couple of weeks. Everything happens in small incisions, but a lot of things are happening inside. So it's important that your body is able to recuperate from that. And Taryn will cover the dietary requirements from that, also take a bit of progression as well. And the sleeve works in that, obviously, by removing 2/3 of your stomach, you're left with a small sleeve, which is why it's called a sleeve. So it kind of looks like this little tube here. And it actually then reduces the physical amount of food that you're able to take in, therefore creating rapid weight loss. Does that make sense to everyone? Yep. And we're going to hear from some patients that have had that done and the success that they felt with that. Is that okay? No? Okay. The third procedure I want to touch on tonight is the laparoscopic gastric band. And it's all about visual, I reckon, don't you? So let me show you what that looks like. So what is a gastric band? A band is basically something that sits around the top of the stomach, puts pressure on the top of the stomach, and creates a little pouch. Okay, and so when you have small meals, you feel quite full, and that feeling of fullness or satisfaction lasts you for several hours afterwards. The band is done through keyhole surgery again. Okay, so once again, they're using these small ports that create little small incisions, and your recovery time is about 1 week, 2 weeks, depending on how you are with pain as well. So it's something that is designed to stay in your body. It's not like a temporary thing, but the advantage, I guess, of the band is that if there is any complication, it's easily removed and reversed. Okay. The band, as I said, is fastened around the stomach. It's a little locked in place, as you can see around here. And the surgeon actually puts in a couple of sutures on the top and bottom of the band just to hold it in place. Okay? It's called an adjustable band for a good reason. It's adjustable. Okay, and what is adjustable about it is that the pressure that's placed on the band, see those little pillows in there? When you inject with some saline in there, it sort of blows that up a little bit. So it adds pressure to the stomach, so you can adjust it according to how the band is actually working for you. So if you're finding that you're not feeling as full and your portions are getting bigger, you can always adjust and put a little bit more in. Or likewise, if you're finding it's a little bit too tight, you can take fluid out. Okay, and the way that it's done is through this little port, and this little port sits underneath the skin, kind of just about there. And it's felt by me when I go to adjust it, and a little needle goes in there. I don't feel a thing, so it's perfectly fine, all right? So rest easy, all right?
Have you got one in there?
No, I don't, but I'm doing a lot of the needling, so, I should know. No. It's not a horrible procedure. The first one's usually a little bit nerve-wracking because you don't know quite what to expect, but look, we talk you through it, and it's really not that bad hanging out with me every so often, okay? So if you are considering the band as an option, you can come up and have a feel and have a look and see what that's like as well. The complications with a band, initially or immediately post-operatively, the main complication is a port infection. Obviously, you know, it's something that's going into your body, so that there is potential for that. So that's probably the main complication immediately. Long-term wise, there are two other complications that can happen with a band, and that is what we call a slip, which is basically where the band slips out of position, and so that can be repaired with surgery. And it's also an erosion. So that's where, for some unknown reason, we don't know why, happens in a very small percentage of people, but basically the band kind of makes its way through the stomach and creates like a hole through the stomach. Okay, once again, it's something that can be operated on. If you did have a slip band, it's not like you'd have to have it taken out, you just have it repaired. If you had an erosion, you'd need to have it taken out. Okay, so they're the two most, I guess, serious complications that can happen with the band. Have I covered everything? I think I have. Has anyone got any questions or concerns? I haven't freaked anyone out by bringing out my big stapler or anything like that. No.
Pretty obvious when it happens.
That is a very good point. So both the band and the sleeve happen under anaesthetic, okay? So you won't really be aware of what's happening. But when you come to see me for an adjustment, I'm not going to give you any local and I'm not going to put you to sleep because it's really not that bad, okay? As I said, I don't feel a thing. All right. And no other questions? No? Okay, well, feel free if you think of something during the night to come up and see me afterwards.
Thank you. Amazing how she comes alive when she's got a gun in her hand, and she seems to love to play with needles, so no wonder she's so good at what she does. A great resource for you to access. Michelle can help you at any time if you've got questions about any of the procedures, and also she'll be there to help you as part of your team and process beyond your date of surgery. All right. I'm sorry about before, and I just wanted to get back to what I was actually talking about with some of the medical conditions, and just starting to think about typically what are some of the things that we see people present with when they're just starting to think about being concerned about their excess weight. And for many people, they've tried everything under the sun before they actually get here. Am I right in saying that? That's probably 99% of people. Yeah, you all sort of pretty much have tried every diet on the planet before you've actually thought about, well, actually that hasn't worked and I need to find something that's going to give me a permanent and a sustainable long-term outcome. And that's the best part of bariatric surgery, and that's what it does give you. It's the permanency, it's the long-term and sustainable outcome that we're really looking for. One of the things that you will hear as a theme throughout presentations from each of our team members is that working with the team is so important. And why do we stress that so much? It's because not only do we know it's going to give you better results at 12 months, that's really important. You can have a bariatric procedure and lose weight and do well, but the long term is so much more important, and what we really feel is so important for us to give you as people coming into this clinic and in our hands is, what do you want to achieve, not just at 2 years, but at 5 years and 10 years. And we know that we can give you an outcome that will see you achieve that permanency and that long-term result way beyond 2 to 5 years. And that's where it's so, so important to choose to commit to working with a team and understanding the value of the connection with working with the team of professionals who are here to support you along your journey. So not only is it really important to make sure that you've got an amazing, technically gifted surgeon, that's key, because you want to make sure that if there's any complication that he or she has seen it before, and that there's no chance that that's ever going to be a long-term issue for you, and that they can fix it and that they've seen it before. So that's really important. But beyond that, what's really important for the next 12 months is connecting and working with a fantastic team of people who are really dedicated and very passionate about what they do to help support you to get the best long-term results. So that's really important. Medically, we want to make sure that if you're on type 2 diabetes medication now, that we can hopefully get that to be reduced to an acceptable level and keep it, hopefully from ever escalating in the future. We see a lot of people actually get off their type 2 diabetes medication, as I was saying before, often even as early as 6 weeks You know, we see people come back at 6 weeks, they're off their type 2 diabetes medication, they're off their blood pressure medication, they're even off their antidepressants, and those kind of results are just phenomenal. And for us to share that experience with patients at that early phase is just, it's actually beyond belief, really. For you to sit there and think, wow, is that possible? It really is possible, and we love sharing those stories with people as they progress. So all of the medical reasons for actually choosing a bariatric intervention is so important. And then obviously the lifestyle outcomes, you know, the improved quality of life that we look to achieve for people is just so rewarding. All right, next I'd like to introduce you to our psychologist team member, Warren, to give you a bit of an understanding of what to expect when you meet him in our clinic. Please make him welcome.
Okay, I'm always a bit nervous if I get clapped before I start. Save it for the end. Anyway, look, before I tell you a little bit about my role, what I'd like to ask you guys is, you know, what's the first thing, if anybody wants to answer, what's the first thing that comes to your mind when you think of a psychologist or seeing a psychologist or the profession of psychology? Anybody want to?
No one wants to answer because you're scared he's going to analyse you, aren't you?
I work with them all every day in my job, so
You're probably not a good candidate to answer
No.
the question. All right. Anybody else want to think of what's the first thing that comes to your mind when you think of psychologist or psychology?
That we're crazy.
Yes, crazy, yes, I mean.
What's that?
Mental.
Mental, crazy, depression?
Yep.
Okay. Anything else? Anxiety? Anything else? Okay. All right. So generally, when I talk to people in my consultation, those are some of the things that tend to surface. They're generally sort of depression, anxiety, mental issues, and for the most part, generally things that are problematic and troublesome in our lives. So, however, I want to sort of help you guys move a little bit away from that sort of thought process and perhaps see me as a psychologist here in this practice in a slightly different light. Because one of the things that we don't consider with the role of the psychologist is actually more on the positive side. So things like setting goals and having strategies to make positive behavior change. And not necessarily only dealing with severe mental illnesses, depression, anxiety. Certainly those things can surface, and a lot of times it's generally just low mood, you know, before it's clinically diagnosed as depression. Sometimes it's just low mood, and sometimes it's just levels of anxiety that need to be addressed. But for the most part, I'd prefer you to see my role here in the clinic as somebody who's here to help you put together strategies and think of ways and means to get the best possible results from your procedure. In much the same way as if you've got a professional sports person who, you know, golf is a sport that's particularly, I suppose, recognized for this industry and using psychologists. And you'll see that golfers, even the top golfers on the world tour and the top 30 in the world tour, a lot of them use psychologists in their team, as part of their team members. So they've got swing coaches, and they've got people who help them with fitness and stretching and all those things, but they also have psychologists to help them control various emotions at various stages of the game. So it's about having teamwork. It's about having the right people around you. And just like the golfer's got a team of people around them, you've got a team of people around you here as well. So you've got nurses, and you've got reception staff who are also patients who have been through very, very similar procedures. You've got dietitians, psychologists. So you've got a team of people here to help you try and understand what works for you. This is my role. So basically what happens is you come and spend a little bit of time with me, probably around 45 minutes to an hour before your procedure. And we talk about you and your background and your family and the people and the relationships you have with various people in your family and what the strength of those relationships are like. Who are the people that are positive peers? Who are those who are perhaps a negative influence? And we look at those things and we strategize together about, you know, what's going to work for you. We discuss the procedures in detail, so we talk a little bit about the behavioral implications of a lap band versus something like a gastric sleeve versus something like a gastric balloon. Because the way I look at it, my experience, you know, working with this patient profile has taught me a lot about what patients are going to experience. So, in the 2,000 people that I've probably worked with now that have had a bariatric procedure, I've been exposed to many different behaviours, and some of them very common, and some of them a little bit strange and odd. But at the end of the day, I've pretty much heard it all. So, when you come into the consultation with me, I'd really like you guys to be open and honest and talk a little bit about what your real challenges are with your weight, so that we can sit down and we can get a clear understanding of where we need to help you and how much help we need to provide to you from both myself and from the dietitian. Okay. So part of that process is also helping you set realistic and achievable goals, and making sure that your goals fall within the statistical expectations, first of all, with the procedure that you have in mind, and that your behaviours and your work-life balance and your relationship challenges and all those things, that they kind of fit. It's much easier to find a fit with the procedure that way than to give you a procedure and expect that your life is going to turn upside down to accommodate the procedure. If there are certain things that have to be changed, then I'll work with you on those things. But generally speaking, we want to make sure we have a nice close match and a good fit. Okay. So it's really not so much about coming in and me ticking the box and saying this person is mentally stable and emotionally fit to go through this procedure, even though that is really, really important. It's more about, for me, it's more about the timing. Is the timing right? It's the right time for you to be having this procedure? Have you got all the things that you need in place to see you through the next 12 to 24 months? And are you well supported? And what I mean by that, if you've got family and friends that are behind you and supporting you through this process. Because generally in every family there's somebody there without a weight problem who's an expert at weight loss. So they're all too quick to offer their opinion. So what we do is we give you unbiased support in an environment where everybody understands and with a fair level of empathy in terms of what you're going through. Okay. So one of the things that we do about 6 weeks after surgery is we get all the patients who have had a procedure around that time, 6 weeks prior to that, whether it's a band or a sleeve, and we get you guys together. So there might be about 5 or 6 of you, and we meet in the dietitian's room down the hall. And basically what we do in that session, it's a group session. So I heard somebody say today when they came in, it's a bit like an AA meeting. It's nothing like that at all. So what it is, it's an opportunity for you guys to come in and reconnect really, really early after your procedure, to talk with myself and Taryn and be reminded of what's available to you, rather than be lost to follow up 3 months down the track. So we get you in nice and early. We get you in at a stage where you've probably been through the most challenging period of your journey. So those first 6 weeks after surgery are generally the most challenging, because you're on a very restrictive diet, and you are making a transition to solid foods. You're also probably a little bit flat energy-wise because you're losing a lot of weight in a short space of time. This is particularly for the gastric sleeve patients. They lose a lot of weight in a very short space of time. And then you're supplying your body with very little energy in return. So you may be a little bit flat. So once you've been through those first 6 weeks, we bring you in and give you a chance to actually share, like you're doing, or like we're doing here, sharing our experience and roles. So we give you guys a chance in a very informal environment just to share with 4 or 5 other patients who have been through a very similar procedure to you, your goals and your challenges and your aspirations. Again, because what I want to try and do is, on a constant basis, is remind you of what your goals are. And when you share them with like-minded people, you tend to take a little bit more ownership of your goals. That's certainly my experience. So, I don't, for my experience has told me that most people don't go say something and then not do it. They generally follow through with when they get to share their goals. And I know a lot of you may come in and feel like you don't want to tell anybody, or you maybe just want to tell your partner and you don't want to let anybody else know. But this is a different environment. These are people who have been through a similar procedure to you, so they understand, and there's a lot of empathy in that. Right? And I'll also talk a little bit about motivation for exercise at that stage. So that's one of the things that we don't cover too much in those first 6 weeks, because we really want you getting through those first 6 weeks and the challenges of making the transition back to solid food without burdening you with other responsibilities and exercise and those things. So there's a time and a place to introduce all these things, and that first introduction comes at about 6 weeks after surgery. And then, of course, Taryn will also have the opportunity to talk a little bit about more dietary guidelines at that stage as well. And we give you guys a chance again to ask a lot of questions that may be on your mind with regard to tolerance for certain foods or your intolerance for foods. So that's basically what you can expect. And then following that first 6-week group consultation, there's a consultation with the dietitian. These are just what's scheduled for you. So the consultation with the dietitian again at 3 months, with me at 6 months, with the dietitian at 9 months, and with me again at 12 months. So you have 5 scheduled visits for you. Okay. Now, one of the reasons we do that is because research has shown that a minimum of 5 visits leads to better weight loss results and long-term sustainability than somebody who didn't access those support. That level of support. Okay. So it's one of the reasons we offer at least five those scheduled visits. If you feel like you need anything else in between, so month 4, month 7, etc., you have unlimited access to the dietitian and to me. So you can come in as many times as you like. Okay. Any challenges that you have. And one of the reasons we do that, particularly in the first 12 months, is because we understand that weight loss is not something that happens overnight. And just like, go back to golf again, because it's my favorite sport by this time, you probably recognize this by now. But one of the things with setting goals, it doesn't matter if it's golf, it doesn't matter if it's a work-related goal, university, you're getting a degree, job, or weight loss. They can all be affected or implicated by changes in your living environment, changes in the dynamics of a relationship, changes at work, changes in work-life balance. All these things can infiltrate and implicate your success in achieving your goals. So that's one of the reasons that we put ourselves in this position to support you, because we don't know what's going to happen over the next 12 months, and we don't know what's going to happen beyond that, with you specifically. So we want to try and help you as much as we can. Okay. That's me done. I've done all the talking. I get a clap. All right, any questions? No.
That's why Rod Pemberton married a psychologist. Ended up winning millions.
Yeah?
He did. He was a golfer. Was doing no good. Married a psychologist and won millions.
Well, there you go. There you go.
Yeah, it was true what you said.
I should do the same thing.
Thank you very much, Warren. I was just thinking when Warren's talking about exercise, that can mean obviously different things to different people, and we love to encourage you to get involved in a range of physical activities after bariatric intervention. We started not that long ago a beginner's running clinic, and that was actually for specifically the, I guess the reason we actually started that was because Carol, who works with us, she's actually away on annual leave. She's also a nurse and has had the Orbera intragastric balloon, and one of her goals was to learn to run. She'd never run before, and when she started out, she could actually only run about 300 metres across a soccer field. And with the support of having her Orbera balloon and a running coach, she actually got to the point, it didn't take too long, where she was actually running 5 kilometres without stopping. And for us to watch her go through that procedure and to see those changes in her was just absolutely fantastic. So yeah, she's not going to get away with them without being able to maintain it now, because she's under our watch all the time. But it's just wonderful to see that people can achieve those kind of things. And just as a totally different example, we had a patient in here this afternoon who's only just on 4 weeks post-op, and she started her journey in a seminar like this here with her husband, who's also had the procedure. Both of them BMIs, her BMI was over 54, and I think his BMI also very elevated. So both in the severely morbidly obese category or super obese categories for both of them, and to watch them go through their journey from this starting point and to share with them where they're up to at the early phase is incredible. So for this particular lady who is here today, she's off her which medication? Blood pressure medication. She's at just on 4 weeks. She's lost about 14 kilos. So seeing that early stage result, and now she's actually already feeling the motivation of that early success to her is, well, I'm ready to start taking on exercise. And that might be for her, she might only have ever walked, I don't know, maybe as far as the letterbox. But now she's thinking, I'm ready now, I've seen the surgeon now, and at nearly 4 weeks post-op I can actually start exercising. So for her, that's possibly something she'd never even contemplated. And now she's actually thinking, I'm ready to start walking around the block. So it might just start with something as simple as that. So exercise can be all sorts of different things to different people, and where you can end up, it's the sky's the limit. All right. Next, I'd like to introduce you to Taryn to talk to you about the role of the dietitian, and I'd like to thank you very much.
Thank you. All right, so welcome everybody. Nice to see a few familiar faces here. So yeah, basically I'm just going to spend a little bit of time and run through and give you a bit of information about the food side of this whole process. So now, basically every person that comes through and has surgery or an alveolar balloon or even non-surgical programs, I'll see you beforehand initially. Now this whole sort of process, there's kind of different stages to it. So from a nutrition or food point of view, it all starts a couple of weeks before. So everybody, the surgeons actually require that you do a pre-surgery diet. So you do that for a couple of weeks before, which is basically a very low-calorie diet where the purpose of that is actually to shrink down the size of your liver. So the instruments Michelle was showing you before to sort of get to the stomach, they've actually got to get in there and lift your liver up and move it over so they can get that in there to the stomach. So this diet that we put you on beforehand, well, it's some people find it quite challenging. It's not that much fun, but we're doing it for a really specific reason. So it is really about making that sort of surgical access here. So with that in mind, I think people find it a little bit easier to sort of stick to it, and it's usually 2 weeks. Occasionally for some people it might be a bit longer or a bit shorter, sort of depending on your BMI. So that's the start. Then there is a progression through, which we sort of think of as your healing phase. So your first 6 weeks or so, it's really, we like to, even though you do lose weight through that time, the focus, certainly from my point of view, is more at that stage about making sure that you're well nourished, that you're actually getting enough fluid, getting enough protein, which can be challenging, for some people. So that's something that we're here for on the end of the phone. Some people cruise through that period really nicely. For other people, they may find it more challenging, and we'll be on the phone to them every day, sort of thing, giving them tips and just trying to get safely through that time. So it's basically a progression on liquids only for a couple of weeks, and then pureed foods, and then soft foods, and then back to normal. And that's it's the same process for the band and the sleeve, although it can, often it sort of might move a little bit more quickly with the band, and the sleeve might be, some people might need to be on one of those phases for a little bit longer, just depending on what sort of experience that they're having. So that's sort of the early stage stuff. And then long term, I guess what we're focusing on then is really trying to work with you to make sure that you're getting a good quality intake and just getting used to how the procedures impact your everyday life. So it can be a really big learning curve to go through. So, for example, with the sleeve, it's really, they're sort of creating a much smaller stomach, so you end up having a little tummy, and it fills up very easily. So there's a really clear cut-off point, and some of the patients that talk to you tonight will probably confirm that it's very much, you can sort of have a little bit of food and then have that one extra little mouthful can be too much, and that can sort of cause you to feel real discomfort. So, there's a process of learning and mindfulness, and this is something that sort of Warren talks to you about quite a bit as well, is really sort of spending some time early on being very mindful and very sort of focused on your eating habits and things like the pace of your eating. That can make all the difference. Just by slowing it down a little bit can make things so much more comfortable for you. And there's sort of some surprising things for some people that pop up that they may not have expected, that can be a bit challenging to adapt to. And one of them that's quite common, and a lot of people, it's almost as though they say, my eyes or my mind haven't quite caught up with what's happening with my stomach. So you're still serving up maybe the same amount of food, and that sort of thing can take a bit of getting used to. And just in the group session that we had this morning, we were talking about this, and one of the girls said, it's not just the way you eat and what you eat, it's also how you shop and how much you cook and where you go to if you're out at the shops to get something to eat. And she was saying how about 6 weeks post-surgery now, and she went to I think it was a food court or something, and she was just on autopilot, and she went and bought a sausage roll and went to eat it, and sort of stopped herself at the last minute and thought, what am I doing? I don't even want this, and I can't really eat it anymore. So she said she just sort of sniffed it a couple of times and threw it out. So, you know, it can take those sort of things that can take a bit of getting used to. You know, what happens if you get invited out to a wedding, you know, 4 weeks after surgery, and little things like that that sort of a little bit different. So yeah, so we work with you and, you know, sort of seeing lots of other people go through and try and give you a few tips and things along the way. But what we also want to try and achieve is that you actually do maintain your, you know, good nutrition. So, you know, when someone's losing a lot of weight, so in that first 6 to 12 month period, you know, you can get this fairly rapid weight loss. So your requirements for some nutrients actually increase, but the amount that you can eat has decreased. So we want to really try and focus on nutrient density. So making sure you're squashing as much nutrition as you can in that small amount of space. So, you know, there's a few other little things that can take a bit of getting used to, like drinking and eating at the same time. You know, how many people sort of automatically sit down and have a drink at the table, or, you know, with a meal, sort of autopilot, just have a drink? And yeah, and it could almost be a bit of a trigger, having you know, having food means having a drink. And particularly with the sleeve, with the band as well, but maybe not quite to the same extent, eating and drinking at the same time is, yeah, it's not, you can't really do it. So there's not really the room for both, aside from maybe a couple of little sips. But if you're sort of having a meal and then you have a few mouthfuls of liquid, you've suddenly filled your stomach, and you know, can make you feel really uncomfortable. So generally we try and encourage people to, you know, have the fluids in between, food separate. So yeah, even that, and then interestingly for some people that can be really challenging. You know, it can take months and months to actually get used to that. Yeah, so the procedures, the band and the sleeve, they do differ a little bit in how it affects the foods and the types of food that you can eat. They sort of work in a slightly different way. So with the band, the food needs to actually sort of pass through this narrowing that the band creates, and with the sleeve, the food just enters straight into the stomach. So because of that, like Michelle was explaining before, you know, the foundation to having a good outcome with a band, it's just so important to have that adjustment level right. You know, so we certainly see people that get that, you know, that come back often enough to get that level of fluid in there just to the right spot, so they can actually eat a really good variety of food. But if someone's got that band too tight, they'll often find there's, you know, you may have even heard, does anyone know anyone that's got a band, or, you know, maybe heard stories out there that people are sort of bringing food up a lot. It's kind of a you know, a common, you know, it is out there. But yeah, often just by easing it off a little bit and going a little bit slower with the eating, it actually allows you to sort of eat a much better variety of food. So as far as the amount that you can eat, you know, both procedures end up at a pretty similar place, so early on, but they sort of work a little bit in reverse. So with the sleeve, it is at its most restrictive early on, and it tends to ease a little bit with time. So from what you can eat 3 months after surgery to what you can eat 18 months later, it'll be a little bit more, because the stomach sort of stretches a little bit with time. Whereas with the band, it's almost like the other way around, because you sort of start with no fluid in the band, you come back for your first adjustment after 6 weeks, you have a little bit of fluid added, see how you go with that, and then it might get tightened up a little bit more. So it's sort of a bit of a process of getting the band to the right spot where you're getting a good sense of restriction. But we are sort of working on the same, you know, that eventually you end up being able to eat a kind of a similar amount of food. So just a bit of a different process of getting there. And that amount, we sort of have a bit of a benchmark kind of amount of 1 cup in a meal, but it really will vary from person to person, from food to food, depending on what stage you're at. And you know, some of the people tonight might give you a bit more of an idea of what they, you know, how much they can actually eat. But for a lot of people, it may be, like say with a sleeve, once you're 6 months or something. I've actually seen a couple of people today, so it's fresh in my mind that may they'll sort of say maybe they'll have like 1 week fixed breakfast, for example, whereas maybe previously they might have 2 or 3 or 4 or 7 or, you know, whatever the case may be, and then they might have sort of a piece of fruit for morning tea, lunch. So like someone was saying today, they normally go and buy like a chicken and salad sandwich, for example. So it's quite, you know, substantial with someone that's about 12 months after surgery, but they can't eat the whole thing. So they'll have half of it and then maybe have half of it later in the afternoon, or if they don't have the other half of that, maybe another little snack of some sort. And then the evening meal they'll sort of eat typically what the rest of the family will eat, but it's just going to be a much smaller amount. So yeah, so it's that, I guess the sort of pattern of eating is something else that we do try and focus on. So a lot of people actually come to us with an eating pattern in place where maybe they skip breakfast and then maybe skip lunch, and sound familiar? Yeah, so
Like the bed until after lunchtime, so breakfast goes at the window.
yeah, it's really common, you know, and then it's almost like your appetite switches on in the afternoon or evening, and then there's sort of overeating later in the day, and yeah, it's kind of like we've got to tip that completely upside down and, you know, sort of take what you're eating and spread it throughout the day. So yeah, so there's all sorts of things like that that can pop up, and there's different things for different people, and that's what we're here for, to try and guide you through that. So yeah, has anyone got any questions? Oh, okay, actually, I didn't talk too much about the Orbira, but it's very similar, really. It's just a much smaller, I probably didn't focus on it that much because there's not as much involved in that sort of transition. There's no pre-surgery diet. There is a bit of you are on liquids for up to a week, and then you are on a sort of more like puree, soft food. So it's sort of like a mini version of the other ones, and you get to the point of being able to eat a very, very similar amount of food as well. So yeah, so even though they all sort of act in different ways, they're all really at the end of the day achieving we're trying to achieve a similar thing, which is actually helping you to feel satisfied of a smaller amount. Okay. All right, well, if you do have questions afterwards, feel free to come and have a chat. Thank you.
You're a very quiet crowd. I hope you're saving all your questions for the end. Write them down now. This is your opportunity, so please make the most of the time to ask questions. No, there's no such thing as a silly question. You can ask whatever you like, so don't hesitate at all. I hope you're starting to get the feel of the value of what it means to work with a team. Are you starting to understand why that's important to you? Because it is so, so valuable, and that is, I think, one of the most unique differences about this clinic in terms of not only have we actually done the first worldwide research on does follow-up attendance equate to better long-term weight loss results, and the answer to that is yes. That research was started here in around about 2001 by our nurse Carol and a dietitian working with a professor on our own patients, and we actually had that data presented at an international conference in Boston, and so we're really proud of those kind of things that we're able to achieve here. And you know, we know from our own internal research the value and why it's so important to engage with you and work with you and hopefully get you to understand why it's so important to commit to that long-term follow-up process. And we do actually offer an unlimited support program. So although there's routine opportunities for you to come in and there's times when we think, you know, it's really important, these are the times you have to come, what we actually offer you now is the opportunity to choose to make the most of those appointments. If you think you want to come in weekly, or if the dietitian's seeing you and she thinks, I really think you should come and see me once a week for the next 6 weeks because we've got to work on these things, then that's your opportunity. So there's the value right there. You can make the most of that. I also really love that we've got dietitians and a gorgeous chef on staff who is absolutely brilliant. Michelle, when she's doing the cooking sessions, is the most organised, incredible person, and she pulls that together with our dietitian, and it's a really fantastic experience. I think the people who've had the opportunity to come along to a cooking demo so far have really loved it. Not only have they loved it, but we've got one lady in particular who, after that session, she actually went home and cooked all of the things that she learnt on that day and posted her pictures on Facebook. And to me, that is the most brilliant success, because not only did she come along and learnt something new, and she thought about, well, how could I change maybe some of the things and how I think about food and the way I eat, but she's gone home and implemented it straight away. So that's the most awesome success I could possibly see. So when you're given those opportunities, I'd encourage you to sort of say, yeah, that's great, I could actually learn something new, and it's a lot of fun. And also with other patients. So we actually run those at the back in our boardroom, lunchroom, staff room, etc., meeting room, convert that into the most awesome little kitchen production area where you actually come along and get to watch a live cooking demo and taste the food as well. It's lots of fun. Okay. So no more questions right now. I think probably what we might do is move on to our patient care speakers. We're already at that stage. Who's ready to start hearing what the real people have got to say, the most important people? I'd like to first of all introduce you to a gorgeous lady up the back there who's sitting there hiding, Leslie. If you'd like to come on up, Leslie has had the intragastric balloon and done exceptionally well. Come on up, Leslie. You happy to go number one?
I might as well.
Why not? You're experienced at this and you're used to being up in front of the camera, aren't you?
Oh yes, all the time.
So, yes. So Leslie's here to just give you a bit of an overview of what it's like to have been through that whole big Orbera process, and she looks amazing and has achieved great results, so please make her welcome.
Thank you, thank you. Well, everyone else has come up here and spoken with no notes or anything like that, but I thought I might sort of come up here and be completely dumbstruck, so I had to bring some paper with me for company. So I guess like many of you here today, I've struggled to lose weight over the years. I'd gone up and I'd gone down, and then last year I was really like at the peak of, I was the heaviest that I'd ever been. I decided that something had to be done about it. A friend of mine had actually come to one of these seminars because she was interested in lap band surgery. And she came home afterwards and we had a chat and we had a look at it both online, and that's when I discovered the Orbera balloon. I probably wanted to lose maybe between 10 and 20 kilos. So for me, it was a very good option. I liked the idea that you could have it in and then it was taken out 6 months later. It wasn't sort of such a permanent thing. But obviously when you've got it taken out, then you have to be really careful afterwards that you maintain the weight loss that you've actually taken off. So after a lot of deliberation, also the fact that I had my son's wedding coming up, which is now I've been to in June, and it was all beautiful. So that was my main consideration, as I wanted to lose weight for the wedding, not look like a big blob in the photos. So I came to these lovely people here who were very supportive, and as everyone said before, the main thing really and the support they give you is that they all work together as a team together. And you come here and everyone's lovely and very welcoming and give you a great amount of support. The procedure itself was quite straightforward. It was just a day procedure, went into hospital, had the balloon put in, and it didn't really sort of interfere. I think I had maybe a couple of days off work and then went back to work afterwards. During that, sort of straight away, I started losing weight. Initially, you're on like a liquid diet, and then as Taryn said earlier, you progress to more pureed food and then to a more thing. But the main thing about it is that you actually learn to eat less. And I guess that's the same with all of them, not the balloon, the gastrectomy and the lap band. And you realise then just how much food you'd eat before. You might think you don't eat an awful lot, but when you start to look at what you're actually eating now, you realise that you probably were eating too much before. Also, just before I started coming here, I started going to the gym, and this was a prelude to try and lose weight for the wedding. And I struggled enormously with the gym at first. I went with a friend who was very good, my gym buddy, and she used to make me run on the treadmill, and I dreaded going to the gym every night because of the running. I just couldn't think. A bit like Carol, who joined the running group. Anyway, gradually as the weight came off, the running became easier. And then I got to the stage where I was actually looking to see how far I'd run, because I could, do it more and more. So, you know, that was good. I started going to the gym more, up my exercise regime, and of course that helped too with the weight loss as well. So I'm happy to say that I managed to lose 15 kilos over the 6-month period, which was over and above my expectations. I don't know. I suppose, you know, I thought I might lose 10 or 12, but I actually lost 15. So I was thrilled with it. I was really, you know, really very pleased. And the good part about it is now that I can go clothes shopping, instead of having to buy clothes that I had to buy before because that was all that fitted me, I can now buy clothes that I actually like. Also, a lot of people have commented on how good I look. That sounds a bit of sort of thing, but you know, people come and say, "Oh, you're looking really great," but they may not necessarily notice that you've lost weight, but they look at you and they know that you look different, and that's a huge boost to your morale. So I found that I'm far more confident now than I was before. I'm not hiding behind clothes, and I'm even, you know, able to come out and talk to you people tonight, which I certainly wouldn't have done before. And also, I've recently enrolled in the 12-week challenge at the gym. So more sort of exercise and learning about nutrition and everything like that. So, so that's my story basically, and I'm happy to say it's been a successful one, and I'm very happy to share it with you people, and hope you all have as much success as I have. But I would certainly recommend these people. They're absolutely marvellous. They really are incredibly supportive, and they'll take you all the way down the path.
Just so that you know, we don't pay any guest speakers. It's so not scripted, and I think it's really great that, you know, it's designed to give you that the real story from their point of view, whether it's warts and all or whatever it has to be, and whatever there are always going to be ups and downs. Every story's different. Every journey's different. Don't ever compare yourself to anybody else. And I always say that to, you know, when we have a husband and wife team come through, or mother and daughter and family. Often we'll see families over time, you know, refer their family members. And I think it's really important to recognise that this is your journey and your experience, and whatever you're going through is going to be entirely different from the next person, no matter who they are. So it's important just to focus on your own experience and what you're dealing with. All right. I think next we're going to move to introduce you to Troy, who I actually didn't recognise tonight. It's very embarrassing. That's happened to me twice. The last 2 seminars, I've had these incredible men who've come along to share their stories, and their change has been so dramatic that I've not actually even recognised them. So that says so much about where Troy has come from tonight, and that gives me great pleasure to introduce him to you to talk about his sleep experience. Please make him welcome.
I'm Troy. At my heaviest, I was 164 kilos. When I first come to Weight Loss Solutions, I was 157. I'm now 113 today, so you just do the maths and what it works out to be. My reason for doing it was obviously weight, health issues. I was on blood pressure medication, which wasn't keeping it in check. It was constantly back to the doctor, upping it. Probably the biggest thing was the embarrassment of getting onto a plane, sitting down and going, it doesn't fit. And luckily that flight with the hostess just come up discreetly. I didn't have to ask, she just gave it to me. So it was obviously the visual issue. Since that, I joined the gym before I had my surgery. I lost a bit of weight before surgery. Then my regime now is, if I'm on day shift, I'm up at 4 o'clock. I'm at the gym for an hour, and then home, shower, to work. If I'm on night shift, what I am now, it's go to work, go home, sleep, get up, go to the gym for as long as I like, or it's get up and go for a bike ride. I've bought a road bike. I bought a flat bar one. Since then I've upgraded to a normal road bike. I've completed 200-kilometre charity rides. I'm probably going to do the Brisbane to Gold Coast next month, just depending on a few things. Every Saturday morning, I have a group of about 5 friends, and we do 50 plus Ks every Saturday. And maybe on Sunday, depending on what's happening, I'll go on a shop ride with a group of different people, ride at a big pack. You probably all hate us, because we're taking up a whole lane. You know, that's it. Where am I?
So what surgery did you have?
I had the gastric sleeve.
Yeah.
So in my first 4 weeks, I lost 11 kilos. So that was always a bonus, and it kept coming off. At the moment, it's probably steady. I have to work hard if I want to lose weight, because I'm at the gym and you're pushing bigger weights because you want to get the guns. So, you know. Last year, in March, I had a abdominoplasty. So I had the skin from here removed, which was 4.6 kilos. And then I went back. I had the handle still. I want to get rid of that. That was 3.8. And then I was happy. I'm going, yep, that's it. And when I was just riding along one day, and I felt I'd rubbed a hole in my bike pants, which aren't cheap. You know, it's $150 for a pair of good pants. I went, nah, 5 weeks ago I had a bilateral flank upper thigh. No, yeah, an upper thigh lipectomy. So that was 5 weeks ago. So, and that was about 1.2 off both legs. So I've had the whole body lift. I feel great. You never ever get sick of saying thank you when somebody goes, oh, you look great. Yeah, thank you. You never get sick of that. I still use my diet plate every night. I've got a diet plate from here. There's your little borders up and things. You don't go to a shopping centre now and look for the closest part to the entrance. You park away where nobody is. It's easy. You don't have to worry about your car doors getting hit. You're just in and out. I'm not on blood pressure medication. I can go into a shop, buy Jag jeans, buy a Tarakas shirt without having to look around, feel embarrassed to go into the big people shop. Yeah, I love life. It's a lot better. At work, I don't go, oh, well, I'll use the car meter to measure out a job. I'll get out, use a wheel, measure out the job. Go, yep. I bought a Fitbit. Everybody know what that is? It's like a pedometer. I think you see it as a waste of money. You can just get a cheap pedometer instead of a $120 one. And it tells you just tap and it tells you how many, whether you're at your limit for the day or you use your app on the phone, it'll tell you you've done 15,000 steps, whatever. So it's just the little things you'll learn to do. I'm still learning not to put that extra bit in your mouth because it is going to feel uncomfortable. At the start, you'd put that extra spoon in and it would come up straight away. It tastes the same way as it went in. So, yeah, that's about it for me. Any questions?
How long ago did you have your surgery?
2011 November. Thank you.
Yes, very good. Wow.
Any questions? Thank you so much, Joy. Put your hand up if you're inspired by that story. Just yeah, I'm sure there's not one of you who's not inspired by hearing him talk about, you know, what he's actually achieved. Those achievements are just phenomenal, fantastic, and you know, 100 Ks on a bike, that's so far. Did you ever imagine that you were going to do something like that when you first had your surgery? Was that a goal that you'd set or something that you'd visualised?
It wasn't a goal, but it was, once I got into cycling, I thought, yeah, you do 30 Ks and you go, yeah, that's good. Then you get to the 40 K and you went, needed him, or this is too easy.
That's fantastic. Well done. Congratulations. And thank you so much for sharing your story tonight. That was just brilliant. Really exciting to hear. And if you're not on our Facebook page, go on and have a look, because you will be so amazed looking at Troy's before shot, having listened to him and seen how amazing he looks tonight. Go and have a look at that image. You'll be absolutely in shock to see that total physical transformation, and where he is today is just brilliant. So really exciting to see you here tonight and to have you share with people here. It's just wonderful. All right. Last but not least, in terms of speakers, have you got the patience to have one more speaker before we? Awesome. Okay, wonderful. Because we love listening to Melanie. I never get tired of myself listening to everything that Melanie has to share every time we have a seminar, which is once a month. It's our favourite night of every single month. So please make Melanie welcome to come and tell you about her story. Thank you.
Now I can never get in trouble for talking at work, can I? So I'd like to give you all this. That's my before picture. So like yourselves, I actually came here as a patient. Actually, I probably wasn't as game as you. My auntie was coming to a seminar and asked me to come with her in case she got lost, because she was too well mannered to say you could do this too. So I came with her, and I'd heard all the stories about weight loss surgery and seen the things on a current affair, and man gets cut out of his house and that type of thing. I'm like, oh, isn't that for people on Dr. Phil? That's not for normal people. Just didn't think it was right for me. I'd heard, someone's friend Butcher's brother died when they had that done, and of course, so we'd all heard those stories, but I actually didn't know the truth or what it was really about. So I came with my auntie, listened to what everyone had to say, and I could not get to the counter quick enough. Like, sign me up, that's it, that's what I wanted. I got home and my husband said, hey, Marika, I went, yeah, good, I'm getting a lap band. What? I'd made up my mind. So like most of you, I had done all the diets. And so it's, the all protein and the no protein and the all carbs and the no carbs and the shakes and the soups, and that's it. We've all done it. And it would really annoy me when people would say, why don't you just go on a diet? Because I haven't been on 74, I should go on another diet. And it's not that overweight people can't diet. We're actually all really good at it because we've done so many. You just can't do it for the rest of your life. I'm like, well, I can't just have what was the soup one? The cabbage soup.
Oh, yeah.
Gives you, I can't have cabbage soup for the rest of my life. And I can't have shakes for the rest of my life. So it's not that you can't do the diets, you just can't do them forever. So that was my thing. I was sick of it. And you'd lose 10 kilos, like, yeah, high five, put back on 12. No, not too good. Lose 20, put back on 25. So that wasn't the thing for me. I said, yeah, I can diet. I just can't do that forever. I just feel like I wasn't programmed with that part of my brain that tells me when to stop. I was always hungry, and I really did feel genuinely hungry. I really thought I was hungry, or I'd have a feeling, a craving for something. So I felt quite genuinely hungry. And I wasn't someone that would eat all day. I was a beauty therapist before I worked here, so I'd just have something little in the morning, and I'd go to work until 2:30. So from 8:30 to 2:30, I wouldn't eat at all because I didn't have time. But then from 2:30 until my eyes shut at night, I did not stop. And I justified it all because I hadn't eaten all day. I'm like, oh, I haven't eaten all day, I can have that, and oh, I didn't have any lunch, so I can have that, and I'd have something in the car. So my average thing, I wouldn't eat through the day. I'd go to get the kids, and I'd get a drive-through Zarrapas, because it doesn't count if you drink it in the car. So I'd go through the drive-through, and I got the biggest thing they had, and I used to have a white chocolate mocha.
Oh, they're so good, aren't they? Yes.
Full cream milk. And then they add chocolate to it, and coffee and chocolate, cream on top, chocolate sprinkles, and I like a sugar in my coffee. Mm-hmm. And because it was so big, in my reasoning, it was the size of 3 coffees, so I'd have 3.
Yep.
So I had that with 3 sugars, and I would have one pretty much every day. Now, that would be the amount of calories I'd have in 2 to 3 days. The coffee I have now, I have soy because I'm actually not that fast on milk anymore. I have a small soy cappuccino. I don't even have a latte because a latte is too milky with no sugar. That's it. So if Zarrapas go out of business, I'm sorry, it's my fault. So that was my average snack, but I didn't count that because I hadn't had breakfast, I didn't have a snack, and I had it in the car to get the kids, and then I'd get the kids, I'm like, who wants a snack, kids? Mummy hasn't had lunch. So we go through drive-through, and everyone would get a cheeseburger. But that didn't count either because I hadn't had lunch, and it was just a snack. So then I'd get home and go, oh, I haven't eaten all day, what am I going to have now? That was my thinking. I think that's, yeah, I knew that was wrong, and I'm not silly, but I just didn't want to admit that I'd gotten that addicted to food. So to me, it's like an addiction. I think I have an addictive personality it wasn't something I could stop. I could never, as I said, I was always in that fridge. If I'd have something, we'd have dinner, and I'd have a very big dinner, have a very big portion, but I'd eat while I was making food as well. And pretty much what I would eat, what I was tasting, is now equivalent to my dinner. I'd always cook a little bit extra. I'm like, oh, I can't.
Quality control.
Yeah, that's exactly right. I think, why dish it up if you don't taste it? It won't taste good if it doesn't taste. Then I'd add something else. I better taste that. Oh, that was good too, so I have another taste of that. Even when I was baking, when I baked cupcakes, this is so embarrassing to tell people, I'd never bake a dozen, because I knew I was going to eat half those suckers, and then people would know. So I baked 2 dozen, and then you could eat a whole heap of them, and no one knew. So I'm like, oh, and then of course people would get home, and I'm like, oh, let's have a cupcake. Yeah, 6 I ate before they got home, straight hot out of the oven, didn't count. I was just really addicted to food, so I'd have my pre-dinner, and then I'd have dinner with the family, and then whatever they left on their plates, I was like a seagull, because it was mine. Nothing went in the bin. I treated my body like the bin. So when I was taking plates out to the kitchen, nothing went into the bin, I went straight in here. But that didn't count, because I ate that after dinner, and it was off other people's plates, and I was going to throw away. So then I'd have that dinner, then it would be dessert, whatever we'd have for dessert, and then I'd be at the fridge. What do I feel like? I just always felt like something, but I just wasn't sure what it was. Oh, I'm so full from dinner, but I just feel like maybe I need something crunchy. I have some
Something
nuts.
sweet.
I have some nuts, yeah. No, sweet, yeah. Have some chocolate. Have the chocolate and then
Kind of block of chocolate.
salty. Yeah, I have some chips. So when I felt sick, that's when I was like, oh, I'm full now. But when I felt sick, to me was full, whereas I realise now that's way, way, way too much. Feeling sick is not feeling full. Also feeling hungry, I think I just ate that damn much. I never actually really felt hungry. I mean, after I had the surgery, I get these grumbles in my tummy and think, oh, what's wrong? Oh my goodness, what's going on here? I was just hungry. But I used to eat that much. I never let myself get really properly hungry. So I think some of the, I won't go in the whole big story. I'll cover it. We've got time if you don't mind.
Yeah, go do it.
Started with the band. I've now got a sleeve. You say, what happened? Yeah. The reason I went with the band to start with is because I'm a control freak, and I was like, you're not telling me what I can and can't have. I want to be in control here. If I had the band, I could have it loose or tightened as I wanted. If I went on holidays, I could have it loosened off. If I wanted to drop a bit more weight for a wedding, I'd have it tightened up. So that was my reasoning. That's why I had that one. So I wanted the band because I still wanted to be in control. And truthfully, I was really scared about breaking up with food. Food's sort of like my boyfriend, and I like hanging out with food, and food was always there for you. And I was really scared about breaking up with food. I remember coming to a seminar and hearing, you can eat this, and you can eat that, and I was like, what? And when they talked about the pre-surgery diet, which I thought, if I could go on shakes, I wouldn't need a bloody lap band. But that was, again, I didn't realise at the time. I just thought they were doing it to be mean and to test you before they gave you a lap band. But it's actually for your health and to make the operation a bit safer. That was my reasoning. I was really scared. I thought I might just decide I prefer to be big and take this sucker out. That was my thing. So I went along with the band, and I'd lost about 25 kilos, and I was one of the unlucky ones that got a slip. I was very, very happy at this stage. It was all going well. Clearly, small portions of food, it was all good. So the doctor said to me, look, we can take it out and give you another one. We'll give you a sleep. I'm like, sign me up. By this point, I'd realised I'm surviving on a small amount of food. I'm losing weight, and I was actually really happy. I'm like, I want this forever. I'll have that, thanks. So that's how I ended up with the sleeve. That my starting weight in that picture there that I sent out was just over 120 kilos. So I've lost about 50 kilos now, like between the 2 procedures. But people even say to me now, if you had your time again, would you have started with the sleeve? I said mentally, I just wasn't ready to commit to the sleeve. So for me, I was happy to start with the band. And again, you've heard a lot of horror stories and things, and weight loss surgery, it's always been a bit taboo. I worked in a beauty salon, and as you probably all realised, I have a big trap, and I love a chat. So I was telling every man and his dog that come in for an eyebrow wax, I'm having a eyebrow, blah, blah, blah. And then, people started to do the, what are you doing that for? And that made me a bit scared as well. So I was a bit scared about that, whereas now it's not so secretive, it's not so taboo, it's so much more accepted. As I said, I'm just not wired that way. I don't have that stop, don't have that handbrake that stops me when I'm full. When I had my band out, I had to wait 6 weeks to have the sleeve, and in 6 weeks I put on 8 kilos. So that just proved to me, I worked here for goodness sake. At this stage, I knew what to say to people, and I'd lost weight with that. I just did not have that stop. I would look down at the plate and go, oh no, it's all gone. Ooh, what's next? I don't have that part of me that tells me when to stop. My husband's an athlete and he's really thin, so that makes it hard too. And he eats a big dinner, and eventually I found myself eating, I'd look at our plates, I'm like, oh damn, we're eating the same amount again. I just let it, over those few weeks, creep up gradually and gradually. So I was really confident having the sleeve going, well, that's what I need. That's how my body's programmed. To me, I've just done something that I need to do to help me cope. So I don't really care about people's opinions, but as I said, now it's a lot more accepted. You tell people, or a mother at school asked me once, she said, did you have that weight loss surgery? I'm like, yes, I did. And the lady standing next to her said, oh, I had that too about 6 or 7 years ago. So when you do share, you find people that you don't know do tend to. And I didn't tell, after I was telling every man and his dog and I wasn't getting the support I thought I would, I stopped telling people for a while. I'll just keep it to myself and see what happens. They'd all seen me go on so many diets over the years. A lot of these clients had been with me for many, many years, and they'd seen me go up and down, or up and down, a little bit down, lots of up. So they'd seen that over the years, and they probably thought, here she goes again. And I was always that cranky cow. I was always a cranky cow too when I was on a diet. How are you, my fine? And Michelle said she loves, sticking needles in people, it doesn't hurt. Well, let me tell you, your wax hurt a lot when I was on a diet. So that was, I was just a bit cranky. I was cranky. I was upset. I didn't like it. I didn't enjoy it at all. And that's sort of another thing that the good thing now is I can have whatever I want, just a tiny portion of it. When we go out to dinner, which I normally only have an entree, but everyone else has whatever they want. And I'll say to my husband, can you order the cheesecake? Yes, I don't want cheesecake. I'm like, just order the cheesecake. So I will have one forkful. I just want to taste. That's it. Okay, cheesecake. So he doesn't get a choice of what he orders for dessert. I make him order what I want. I just want to taste. So, and you are satisfied with that. If someone had said to me once, oh, you'd be satisfied with one Tim Tam, I'd go, yeah, right. I used to laugh when I read the label on the back of the Tim Tams, and it used to have calories per serving and calories per packet. I'm like, isn't the packet the serving? Who doesn't eat the whole packet? I just didn't get that. Again, it's the whole packet. So if someone had said, you'll have one, and you'll be okay with that, I would have said, yes, one packet. But no, it is. That's the thing. I'm just satisfied now. I'm not constantly standing in the fridge going, what next? What have you got? There's got to be another food group. There's got to be another layer on that triangle because I just can't find what I want. I'm just satisfied now. I think that's the thing. I'm not constantly looking for food. And just even being more comfortable of going to things at school. I don't know if any of you have little children. When they bring out these teeny tiny little chairs for the mums to sit down in, I'd say, oh no, I've been sitting all day, I'll stand. There's no way I was sitting in that thing. I didn't want the embarrassment of breaking it or whatever would happen. I was like, no way. And going to theme parks with the kids and never going on the ride. Like, I'm not getting on that. First day, I wouldn't have fit in it, but I didn't want my kids to have to be embarrassed if they asked me to get off. And my daughter always wanted to go horse riding. I told her I was scared of horses, but I was really scared that I'd get there and they wouldn't let me on the horse. So I was talking to someone the other day about hanging out your washing. I only realised now, when I used to hang out everyone's washing, and I'd always sort of hang mine with a bit of a crease in it, because it was just really confronting when you hang out your pants and they're that wide, and everyone else is washing's on the line. In the end, I started to put my stuff in the dryer because it would really upset me looking and going, oh, look at that. Oh my God, they're my underpants. The birdies would come and sit in there. But no, it's little things like that that people don't know unless you've walked in our shoes. So someone says, go on a diet. I say, go to hell. You have never walked in my shoes. You don't know what it's like. This has just been absolutely life-saving for me. I've always been a fairly outgoing person. But you die inside and you cry in those change rooms and people don't know. As I said, I'd eat in my car because I didn't want people looking at me eating because I'd be thinking that they're going, look at that fat girl eating that big Mac or whatever I was having at that time. So I would eat in my car, and I used to eat in my car a lot. And I'd hide the wrappers because I didn't want to have to admit. People could see from the size of me that I ate a lot. But I just didn't want to admit it. And it was really hard. And as I said, everyone's doing that. Oh, you should go on a diet. Or some lady said to me once, I've got a nice face. What are you doing that for? I went, what the hell? I said, I'll be a dead person. And my mum was the same. She said, oh, no, I'm really worried. After I'd had the surgery, she'd dish up dinner and I'd say, could you just put mine on a bread plate? That's all I eat off at home. And it's more for the fact that it just looks dumb if I dish up my dinner on the big plate everyone else has, it just looks a bit silly. So I dish it up on a bread and butter plate. It looks quite full, and again, it's the head thing. Definitely use Taryn and Warren, because half the battle's with your tummy and the other half's with your head. I still, to this day, 3 years later, dish up too much on my plate and don't finish it, because it's just, if I actually dish up what I actually eat, it just goes, I'm not full. Yeah, so I always put on a little bit more and just don't finish it. That works for me. That sort of, my mum said, oh, if you only have that amount of food for the rest of your days, well, you could get sick and die when there is more chance of me dying of the complications from being obese than there is of eating less food. I'm fueling a smaller body, so I don't need as much fuel as I used to. So that's sort of the basic there. A little bit of difference between the two when they talk about overeating. Everyone always says, that lap band, is that the thing that makes you vomit? Everyone's heard that story. And the thing is, yes, if you overeat the band, you will vomit. The band didn't make you vomit, you made yourself vomit because you overate or you ate the wrong thing. So if you know someone with a band, I think we all did, and say, oh, my friend's got a band, she vomits a fair bit. Well, it's not buying the food or it's not putting the food in her, she does all that herself, or he. So that's the thing, if someone is being sick with the band, or if you have a band and you are being sick, it's too tight. So you can have it, and that's the thing, again, head, Warren, when you're thinking, oh, I have it really tight and I can't eat anything, so I'll lose lots of weight. That's not how it works at all. That will just make you go for the wrong things. Oh, I can't eat any food, but if I munch up chips enough, I can, and I can probably get in a milkshake. So you're choosing wrong things. Have the band loosened off a bit, you can get in salad and vegetables and fish and meat. So that's something you need to work with as well. Now when we're sick, it's about to get graphic. Michelle will give you all the medical things, and I'm about to talk about spew. So when you do overeat with the band, it's not like you're going to vomit up carrots and feel ill and nauseous and all that. You are really just going to bring up what you've overeaten in a nice little ball of saliva. So trip to the bathroom and you'll feel it. You just cannot swallow. You're swallowing and swallowing and it's just sitting there. You don't feel nauseous. You don't feel really ill. So don't panic about that if you do overeat, or you think, what happens if I do overeat? Am I going to? No. You can really just excuse yourself, go to the bathroom, Elvis leaves the building, and then you come back. So it's not horrible vomit, and you're not sick for hours. So it's socially quite acceptable. Sleep, not so much. If you overeat with the sleep, you really just feel sick for hours. But it's not as forgiving as the band. That is the difference. But again, they're both doing the same thing. They're pulling you up. It's a handbrake. They're both pulling you up, saying, "Whoa, that's enough." You will find that everyone has a different level of full, so you won't know that until you try it. And let's face it, we don't get to being overweight by not pushing the boundaries. So you will find that when you do that, I just have one more bit. I'll just have one more bit. Oh, too much. So everyone will sort of know their boundaries, and you'll feel that. I feel it now if I find myself burping, or if I sort of sit up to take a big breath. To me, that just used to be take a big breath to get more in, whereas now it's like, oh no, I'm full now. That breath to me means I'm full. If I need to take that big breath, to me that's okay, you're full now. Whereas before it was just making more room to fit a bit more in. So everyone has different signs, but that's sort of the main difference with the two. You do have a few food restrictions with the band. Dry meats can be a bit of a problem for people, and thick breads like thick white bread, scones, that type of thing. They're just too heavy. With the sleeve, not so much, but I found I couldn't have a lot of milky products after the sleeve. What about you, Troy? You? Yeah. A lot of people go off dairy after the sleeve, and I was one of them. So I just went off dairy pretty much altogether. Listen, I have soy milk now, and I would no sooner have a milkshake than jump in the fridge. So it just doesn't appeal to me at all. And fried food too. Yeah. Fried food, you can taste the oil. Your taste has changed a little bit. So when I taste fried food now, all I can taste is the oil. And it's funny how when you slow down with both of these, you really have to slow down to eat because you'll just get full so quickly. And you choose different foods. I mean, I was a guts to start with, and I'm still a guts. My mind has not changed. If I can pick half a handful of hot chips or a big bowl of salad and meat, I'm going to go to salad and meat because I get more. So that's just my head. When you slow down and eat, things taste a bit different. Everyone loves hot chips. You throw them in, wolf them down, and you get that taste of salt and hot, and it's all yummy. You put one hot chip in your mouth and chew it for a long time, it just tastes like old potato. It's not as fun anymore. So I just don't choose those things. So when you eat slower, you will choose different foods. So that's another thing as well. So you both need to slow down to eat with those. And no drinking, no eating. I don't know if a lot of you have heard of that one. You can't drink and eat at the same time. Two things. Not very often, it can wash the food through and you can eat more. If you want to test my theory, you can try the other one, which was me. I'm like, I don't think I like to do that. First time I went out and forgot about it. I had my band and was somewhere and a little bit of champagne. Of course, the first drink I had when I could. Had a little canapé. I went, hello. Out she came like a volcano. So if you want to test the theory and see if you're the one that can wash it down or it comes back up, that's up to yourself. But it's not, eating and drinking is just not a good thing. You can't get enough of each in. So break that habit now. I still find myself, I started, as soon as I said I was having the surgery and they said that, I went, okay, I'm going to take that drink away, which is normally soft drink or cordial, when I'd have my dinner. I still found myself going like that all the time. It was a habit. I wasn't actually really thirsty. It was just a habit to eat and drink at the same time. So you'll probably find it is more of a habit than anything. If you are physically thirsty, you can have a little sip while you're eating. It's just not, we're not guzzling while we're eating at the same time. That's the thing. That's probably the main difference and the main consequence of both of them. Like Troy, I've had a little tidy up. So I had a tummy tuck and I had my breast reduced and lifted. But it's not something everyone needs. It's personal choice. I know I was concerned, like, what about all the excess skin? But then it came down to, well, I don't want to try and disguise excess skin or the weight. And it was much, much easier to disguise a bit of excess skin than it was to hide the weight. So that's something that can happen. Women, unfortunately, don't bounce back as well as the men do. Our skin doesn't have the elasticity that theirs do. But it's not a necessity, and it's not something that I really let worry me or stop me from having the surgery. I mean, I did that night brush event recently, and I also go running, and I do a lot more exercise. We used to water ski when I was younger, but I stopped doing that because I could pull myself out of the water. So we water ski again. But things like that I can do again, and none of that has to do with the surgery. That was just losing that bulk of weight, 50 kilos, which is a person.
Jude online has just asked Mel, is it the lactose that causes issues for going off dairy?
It just tastes very thick and creamy. It's more of a taste thing. I think your new stomach is a little bit sensitive. Some people say they can have dairy, but the majority of people just say it's too heavy in your stomach. You prefer something lighter. If you're going to do a milky substance, it's normally skim milk. I even find trim milk is a little bit too full for me. So if I ever have any milk product, it's skim milk. No, I don't have creamy sauces. To me, pasta only came in cream sauce, didn't come in tomato sauce. I don't have creamy sauces or anything on things now. So yeah, that's probably it. Any questions for me? I've probably yapped on and you've got nothing left to ask.
You're perfect.
Great.
Perfect.
Thank you, everyone, for coming. Thank you.
I don't think there's one person who doesn't find something that really connects when they listen to Mel. I actually had a lady today from Darwin who rang me, and I said to her, she said something to me, and I said, I've got to borrow that quote because I thought it was such a beautiful comment. She's booked to come over here in September, and she's struggled with her weight for a long time, and she said to me, I'm a cupcake away from diabetes. I thought, that was the cutest, that was the funniest way of describing it, but for her, she's that close, and the diabetes issue was the impetus for her to choose to actually make that call today. All right, I'd like to just give you a bit of a rundown on how things work, and if you've got any questions about the process, then please ask me. So before you actually have surgery, obviously you're going to connect and consult with all of our team members, and that's a really important phase that you go through. Obviously it's very individual, it's focused on your particular needs and aspirations, your goals, and identifying, firstly, obviously it's got to be the best procedure for each individual. And that's something that you'll go through in consultation with the team. So typically you consult with the dietitian, the psychologist and the surgeon. For people who come from a distance, if you're travelling and you've got limited time off work, it's not a problem to do all of those in one day. Those days tend to be pretty hectic because we do have people who travel from a long way away and they like to try and economise travel time, time off work, etc., and try and manage to get all of their appointments on the one day. But we're happy to oblige and sort that out for you. So that's typically how you start. If you're looking to access early release of funds from superannuation, there's a couple of systems that we can choose to guide you through to help you with that process. And that is often for patients who are self-funding, don't have private health cover, and need to find what are the financial options for me to access this surgery. Early release of super is a really common one, and I think it's a great financial opportunity for you not to actually tap into your day-to-day finances, but find a financial solution that allows you access to surgery and the opportunity to change your life. So we support patients in that process every single day, and there's a couple of ways that we do that. Either we help you and guide you through that system, or we can actually refer you to a company who works with us to take all of the guesswork and the challenge of dealing with the Department of Human Services and your own personal super fund and managing that process yourself. So if you don't want to do that yourself, then we've actually got a company who will manage that for you, and that they just take an additional fee from your access to super fund so that you can go through that process. It's very common, it's very easy, and I would support any patient who needs to have surgery to provide them access to support them through going through that system. We also have a company who help patients a little bit like a personal loan for surgery, designed for surgery. The company that we typically refer you to is called MacCredit. There's lots of information in the bags that you've been given tonight, and also contained in there is Slim magazine. You'll find in Slim there's all sorts of articles to read, stories about patients who've been through the clinic, articles from Warren and Taryn on mindfulness. So lots of really interesting and relevant information. So take the time to go through and read the magazine as well at your leisure. Questions about the process and what happened next? Anyone got questions right now? Okay, so I guess probably the most important thing, and sorry, before I actually go on to that, I'd actually really like to acknowledge everyone online tonight has been incredibly engaged to asking lots of fantastic questions. When I asked for a show of hands earlier if you were inspired by listening to Troy, so nice to see people online actually comment that their hands were up. I thought that was just awesome. So great to see that you've appreciated and made the most of being online and getting involved in our presentations tonight. So thank you so much. All right, back to where I was. So I guess really from all of you here tonight, you've made the commitment to come along tonight because you've decided that now's the time that you need to make a decision to change your lives. And I guess if you stay sitting in the seat and where you are right now, nothing's going to change. So the most important thing that you can do is choose to make that commitment to yourself to create the change. We will help you every step of the way. I can't commend you enough to the awesome team of people here who will support you. They all share the passion and the vision that I have for helping people change their lives and achieve amazing outcomes with the benefits of weight loss surgery. So you'll have a great team to support you, to guide you, hold your hand from A to Z and see you achieve your goals. So I always like to actually support and encourage people who are here in the room and who have made the effort to come and listen to us tonight. If you want to take the first step, we bulk bill your surgeon visit, so that's really key. That's a unique opportunity that you can make the most of. You can actually make that booking tonight. Who's ready to take that first step tonight? Who's ready to actually say to themselves, I'm ready to make the change and I want to actually explore for myself?
I have a year waiting list. I've got to wait a year though for my private health cover.
Yep, sure. You can actually still start the process even if you've got a 12-month waiting time for your health insurance to kick in.
Yeah.
I know Taryn's worked with patients who have gone through that time frame of joining a fund, waiting 12 months. I've seen patients lose, I think, 30 kilos working with Taryn in that 12 months leading up to surgery. And so they were focusing on the goal, the end result of actually getting there. But working with her for 12 months in advance had them in such a great space and place and all ready for surgery. It was just wonderful to see. So, and that particular person's gone on to great success as well. So you don't have to wait out that waiting time. We're not going to prevent you from accessing working with the team in advance. Yeah. So for anyone in the room tonight, if you're ready to take that first step and make your appointment to come and see us, we're happy to give you the 24 months of support services after surgery, which is a huge value to you. I'd encourage you to take that first step and make the opportunity to take that step now. I've got someone in the room who's already seen the team, so I'll extend that also to having that 24 months of support and aftercare. All right, any questions at all tonight before we close off? Formalities, anything at all? Yes?
Prices on the surgeries, or
Yep.
what the whole,
Sure.
from start to finish.
Yep, so we will actually give you, we've got information sheets that we can give you tonight that will give you a breakdown of all the fees and what that means. So, yeah, I guess the most important thing is it is a big investment, but it's an investment in the rest of your life. It's a really worthwhile one. I've seen patients who not only report that their health and well-being has drastically altered over not just the 12 months but beyond, and they also talk to us about their financial health and well-being changing, and it's something that I hadn't even thought about until I had a lady in here as a guest speaker a few months ago, and she's a gastric banding patient who lost about 136 kilos with her lap band. An amazing story, beautiful story. Took her a few years, so she started at well over, she was about 215 kilos when she first had her surgery. But she talked about how she changed her financial well-being as well, because her job prospects and the kind of things that she chose to do beyond the changes that she made to her health was so dramatic that she put herself in a situation where she was all of a sudden living a different lifestyle and able to, her financial, goals changed also. So it was really nice to see that that's another added bonus and an outcome long term. Loved that story. All right, any questions for me at all? You're welcome to stay and chat to all of our team members. I'd like to thank everyone online for joining us. It's been a pleasure to have your company. Thank you all for coming. It's been great to have you here tonight, and thank you to all of our team members who've been here to share with you what their roles are. I hope you'll all have the opportunity to work with them shortly. Thank you very much. Thank you.
Going last evening, but I don't know what now.
Harry, thank you both for coming tomorrow.
Well, I was thinking of, I probably want to use more than the balloon thing, but I'm here about sort of doing anything sort of totally permanent. Yeah.